That sound means it's time to verify. This is a heavy one today about an important COVID-19 metric. And I want to warn you, if you've lost a loved one due to COVID-19, this information might be triggering because this verify is about COVID deaths. We get this question quite often. Ken Burrell asked, Megan, is there a way to verify that all deaths are actually from COVID? That's a fair question, Ken, and we've seen a lot of confusion about this since the CDC published its COVID-19 comorbidity report, showing 94% of COVID-reported deaths from February to December 2020 had more than one cause. Only 6% of death certificates listed COVID-19 as the only cause. So let's verify. Our sources are the CDC, the North Carolina Department of Health and Human Services, and infectious disease physician Chris Uhl with Atrium Health Wake Forest Baptist. They all say yes, COVID-reported deaths are COVID deaths, but COVID-19 might not be the primary cause.
It has to be listed on the death certificate as either the primary cause or a contributing cause of death. Sometimes, particularly the contributing cause can be a little bit in the gray zone, and then it's up to the doctor who is dictating the death certificate.
The North Carolina Department of Health and Human Services notes our state's COVID deaths include people who have a positive COVID test, who passed away without fully recovering from COVID and had no alternative cause of death identified. The CDC's reporting guidance here is broader. It explains in most COVID-reported deaths, COVID is likely the underlying cause listed below the immediate cause. For example, COVID-19 could prompt acute respiratory acidosis or lung failure, which is what ultimately caused the person to pass away. And where the reporting can get tricky.
For instance, if a person was in the hospital for 45 days with the initial admission for COVID and the actual death is due to a stroke complicating a long ICU stay, how would you record that death? Usually that would be recorded as a stroke as the primary cause and COVID as a supporting or contributing factor. Those are then be counted.
Dr. Uhl said that's why sometimes there can be some over-reporting of deaths in all public health scenarios. Yet national infectious disease expert Dr. Anthony Fauci testified before a Senate committee last year that he thought COVID deaths were actually underreported. Either way, experts note these counts even out over time and do provide an accurate measure of the trends. In conclusion, we verified, yes, it's true. COVID-reported deaths are from COVID, but in many cases, COVID is the contributing and not the immediate factor of death. The physician must determine those factors and record them on the death certificate. Please remember, as we talk about this, behind every number is a person and a family who is grieving. The CDC reports we've lost more than 643,000 Americans to COVID-19 since this pandemic started. And health experts emphasize time and again, the best way to prevent severe cases of COVID-19 is to get the vaccine. With your Verify, I'm Megan Malaris.